Welcome to Joa Fitness Health Wellness Video Podcast, a space to ignite your day through positive conversations. We bring people that have created excellence in their life, sharing high vibration in their reawakening path.
Hello, my friends. You are listening to Back into Alignment, and my name is Joa Rivas. Thank you so much for tuning in today. I wanted to introduce you to our new guest. Every week, we interview healthcare professionals and everyone that is actually in the journey of spinal health. Today, we have a physiotherapist from the Guelph city, basically here in Ontario, and he is a physiotherapist and a graduate of the Queen's University and McMaster University. He has furthered his education through the manual therapy training levels 1 and 3, acupuncture, vestibular rehabilitation, concussion, and much more. He is the director of Eramosa Physiotherapy in Guelph, Ontario. He loves to do snowboarding, climbing, and cycling with his family. I'm so excited to get to know more of Dave's life, including his interest in volunteering all over the world. So let's get to start our podcast today. Happy new day. Happy Friday. You are listening to Back into Alignment. My name is Joa Rivas and I'm in the city of Toronto. I am so excited for those new listeners and for you that always listen every Friday. These conversations about spine and health, which is very important for people that have a stagnated position sitting for long hours. Perhaps you are suffering of a back pain, of a neck pain, or maybe sciatica, or maybe you have heard that your mom has some osteoarthritis. All these are topics that we discuss in this podcast. So get ready, comfortable to meet a new guest. I'm excited every time I have a new guest because there is so much to learn from the practitioners around the world. Everyone comes with a story beyond the academics. They do have a story behind it. Dave is a physiotherapist that is graduated in the Queen and McMaster's universities. He actually has learned many different approaches to mobility, to health. He is an acupuncturist. He also practices vestibular rehabilitation, which is actually something interesting. I would love to go deeper into this. He also teaches courses, so he's actually educating. And Dave is treating his community on Guelph with all these therapies and also teaching the healthcare professionals. And he's a father, and he also loves to volunteer in places that need some support. So he has gone to Kenya, Uganda, Haiti, El Salvador. So I would love to know a little bit more about this volunteering. What is his main goal in these actions? And also he loves rock climbing, cycling, and snowboarding when it's possible with his family. So thank you, Dave, to share. I see that you have a lot of passion to move your own body and also to provide support to the community in Guelph. So very interesting, Dave. Tell me a little more about when did you start feeling this passion to learn about physiotherapy?
So the very first time, I went into university, I didn't know anything about physiotherapy. And I thought I wanted to be either a doctor or a lawyer because that was the only things that our guidance counselors told us we should be if we went to university, which was a little short-sighted, I think. And kind of got in and realized I did not want to be a doctor. What they do for a living just does not match with my personality. I like to be moving all the time, talking to different people. And so I started volunteering. I volunteered with a chiropractor, with a physiotherapist, teachers, different things, and really fell in love with physiotherapy at that point. It was a job that I could see myself doing forever. It didn't feel like work. It just felt like fun. I like to move. I like to teach people exercises. I like to help people. So it was kind of the perfect union of all the things that I'm uniquely wired to do.
So you were practicing any sport when you were a kid?
As a kid, I played a lot of baseball.
Okay.
I was a competitive swimmer. What else did I do? Those were the main two.
Okay. So you start by practicing with other physiotherapists and you really love this. And did you get this idea before, just because you are in a sports, you're like, I love sports, maybe I get connected to something related to this?
No, thankfully I was injury free.
Okay.
Yeah. So it really was just kind of in university volunteering, trying to figure out, okay, if I'm not going to be a doctor, what am I going to be? And yeah, thankfully I had a good mentor, somebody who let me volunteer with her and kind of showed me the ropes, and I just fell in love with it.
And in this process of volunteering, were you just observing, or were you just actually listening? Like, what was the most interesting part that you enjoyed from this volunteering?
Well, initially it was listening and learning, and then as I got more familiar with different things that they were doing, they would let me do things like ultrasounds or using the TENS machine or the IFC machine, helping people to correct their exercise positioning, those sorts of things.
Nice. And now you're a father of two,
I
and one
am.
of your mottos is get outside and play. So I guess you get outside and play with your kids a lot.
Absolutely. Yeah. We just moved into a house that's in the forest, and we have hiking trails right behind our house, and we just are always outside playing, riding bikes, running around in the forest, catching fish in the stream. It's great.
Nice, super, super. And how old are your kids now?
They're 8 and 10 years old.
There is so much we learn, right? When we see the kids growing from the moment that they are turning in the floor to the moment that they start crawling, we're like, okay, this is how the spine is actually developed. And it's fascinating how we start developing the reflexes and all this. And this is what I do with the posture school program that I teach. I teach people to realign their bodies back to where they were on the floor as when they were babies, right? So it's actually interesting when you are a father, you can see exactly your kids moving. It's like, okay, I can see.
Yeah.
Now, one of the questions that I wanted to talk to you today was related to back pain. And now that you are in constant contact with people that come and visit you for some solutions related to back pain, what is the most common reason people come to visit you this year?
It's usually kind of a 50-50 toss up between shoulder pain and back pain. And if I look at the stats, it changes kind of year to year. So right now, or at least last year in 2021, when I looked at the stats last, it was lower back pain was our primary body part.
And what age are normally the people that visit you with this particular condition?
All ages. We have a high school right near our clinic, so we have lots of young athletes from the school that get injured, and then we have people who are in their 80s and 90s. And we have an osteoporosis and as well as a bone fit, like a hip and knee arthritis class for the seniors. So we tend to draw from both ends of the spectrum.
Oh, okay, okay. So after post-pandemic, people start taking jobs that were more remotely working from home. Sometimes we don't have the proper ergonomic desk that supports our body while we're working. Do you notice that there is a post-pandemic effect this 2022 where we can get more of those health conditions in the office? Yeah.
Yeah, absolutely. So I think, like you said, the alignment issues are definite, and that causes lots of back pain and issues around that. But then the other thing I'm seeing a lot of is people who come in who have put on a lot of weight. I treated one guy who put on 160 pounds. He's the most amount of weight that I've seen. But most people, somewhere between 20 and 40 pounds during the pandemic. And all of that weight, especially if you're somebody who holds it in their midriff, that's a lot of pressure pulling you forwards on your spine. And to add that much weight in such a short period of time creates all sorts of back pain issues and alignment issues like what you are used to dealing with. So.
Okay. Yeah, that's an interesting factor. By being static and sedentary and also changing the lifestyle, this develop not only back pain, but actually gaining weight that actually will affect the joints, especially the knees and the ankles. That's an interesting approach I actually didn't put together that actually I'm learning with you. So now you notice people come heavier and having more back pain. So those are kind of like the two factors that you notice that has been happening after the pandemic.
Yeah. And like you said, the ergonomics too, because if you went from a job where you could get up and go to the coffee machine and talk to your colleagues and have that kind of social outlet, to now lots of people are working way more hours from home than they were working before. If they're constantly sitting for 12, 14 hours a day instead of getting up and moving, then their backs are getting stiffer. They're getting kind of like an overtraining type issue where you're doing the same thing so much that the muscles on one side get stretched out and the muscles on the other side get tight, and then that throws the whole thing off.
Mm-hmm. So let's put together a simple scenario. So I come to you, I'm experiencing neck pain and also back pain in a 7 rate, 1 to 10. 10 is very painful. I'm on a 7, so I really need you. What is the approach when you're taking someone with back pain to the healing process?
So the first thing is to do a really, really thorough assessment, because where the pain is might not actually be what the cause of the pain is, right? So we need to figure out, is it something that's, a pinched nerve? Is it a tight muscle? Is it a postural issue? There's so much variation. Did you get in a car accident and that's why everything's tight, or so many different reasons. So once we figure that out, then we can address that. And if something's tight, we need to make it looser, whether that's a muscle or a joint. If something's too loose, then we need to strengthen the area and make it tighter and stronger. And if there's an imbalance, then we need to do the same, but one side needs to be tighter, the other side needs to be looser. So a combination of stretches and strengthening. Mm-hmm. And that would be both passively, things that I would do to stretch the person out, and then actively, if physiotherapists, we prescribe exercise. We don't give drugs, we give exercise. And if people don't do the exercises, they're not going to get much better. So it's a big part of what we do.
And how do you notice these teenagers that you get to the clinic and they have already at that age already come with some imbalances? How do you notice their reception when you tell them, let's practice these exercises, we need to do them every day? Like, do you find them a little bit accepting the process, or they just like, it's going to get better later? Or how do you see the teenagers receiving this type of treatments?
There's two types, I would say. So there's the athletes that want to come in, they want to be better and they want to get back to their sport, and they're very compliant. They work really hard and get better very quickly. And then there's the people whose parents drag them to physio and they don't really want to be there and they don't see the point of it. And those people are not generally as compliant, is the word that we we use, meaning they don't do their homework when we send them home. And so they, if I see them once or twice or, at most 3 times a week, but they spend the other 4 or 5 days a week not doing anything, they're not going to get better very quickly, right?
Okay. So they come to see you, they do the treatment, the therapy with you, then you give them a homework.
Yes, correct.
Okay. And normally the treatments are every week. Like, what would be the most frequent, the frequency to see you?
So 3 times a week would be the most frequency. And that would be somebody who's maybe they've broken their arm or broken their ankle, and they've been in a cast for 8 weeks, and then they take the cast off and now the joint doesn't move. And so we need to take that joint and we need to force it to move, and we need to do it frequently in order to get the range of motion back. Or it could be somebody who's in a lot of pain. You said your neck pain, when we were talking about your scenario, was a 7 out of 10. If somebody comes in there a 9 or a 10 out of 10, then we're going to need to see them and do just a little bit more frequently, because they're not going to be able to tolerate as much during each treatment session.
Yes. So what do you think is the most common mistake repeated with back pain that aggravates the back pain?
I know it sounds funny, but stopping movement, I think, is the biggest mistake that people make, because it hurts to move often, or it hurts to move in certain directions. So people just get afraid of moving at all, and then they lie around. So there's a really interesting study that was done. I think it was back in either the late 80s or the early 90s. They took a bunch of completely healthy university age students and they had them lie down in a bed, and they weren't allowed to get up. They weren't allowed to contract their muscles. They were just lying there. and they were taking muscle biopsies to see how quickly their muscles atrophied. After 3 days of lying there constantly, the atrophy in those muscles was so significant that they had to ethically stop the study because they weren't losing so much muscle mass at such a quick rate. So one of the things I like to say to people is use it or lose it. If you don't use those muscles, contract them even a little bit, then they will start to atrophy, and then your problem's going to go from bad to worse, because you'll go from being in pain to being in pain, and now you have severe weakness as well.
Yeah. I usually say motion is lotion, and definitely moving is so important to stimulate the bone density and also the muscle, and retain the muscle, which is so important for women, especially after 40, that we go towards sarcopenia. And there is actually a percent of between 3 to 5% of muscle loss every decade if you stop from moving and training. So definitely for those women that are listening to this podcast, we definitely encourage you to start lifting weights that appropriately you can do with the proper alignments. But it's so important not only to do cardio, but also to actually encourage to lift some type of weights. So yeah, that's interesting. So moving is one of the ways that you feel like this is what's happening. That's one of the consequences from the pandemic, that we were working more at home, sitting, and everything was closed. So we were more sedentary, and definitely that brought two main issues, which was more back pain, and then now we're working with a weight management issue. So very quick, that you can bring maybe one or two case studies that you can remember, people that come with like a back pain this past year and related to the pandemic that you never seen before. Do you have any case that you remember?
Sure, yeah. I've got two good ones that kind of show the opposite end of the spectrum, if that works. So the first person was a lady who, she was about 83 years old, and she had a condition called Spondylolisthesis, which is a fancy word for one vertebrae kind of sliding forwards on the other one. And that was causing a whole bunch of compression through her spinal cord, which kind of presented as sciatica. So sciatica is pain kind of referring down the leg. It's a broad term that gets used, that can come from a number of causes. But in her case, that was what was the cause. So when the spine does that, we can't change the ligaments, we can't change the spine itself, because it's bones that are resting one on top of the other, and there's nothing holding them together except ligaments and muscles. So the only thing left to kind of pull it back into alignment is the muscles. So we had to work quite intensely initially, because she had really not done anything actively for quite a while. As the pain got worse and worse and worse, she got more and more sedentary. And then she had no core stability at all. She just walking was a huge chore for her, partly because of the pain, but also because the more she moved, it seemed like her spine was kind of falling further into that misalignment. So, like I said, we worked really hard, got her core stability active, taught her the difference between abs, which most people think are their core muscles, and what the actual core muscles are, which is the whole wall around front, back, top, and bottom of the middle of your torso. So she was kind of one extreme in that her spine was just all over the place, super loose. The other person was a young university age. I think he had actually just graduated, and he was fit. He was this big macho bodybuilder guy, and he didn't understand why he would have pain all day. And he had taken a new job after graduating, working for a tech company. So these tech companies, where I am out in Guelph, we're close to Waterloo, and Waterloo is where Google and RIM and all these tech companies are. There's tons of startups. So anyways, he took a job at a startup, working like 14, 16 hours a day on his computer. And he couldn't understand why he would go to the gym. He's ripped. He looked like a supermodel, but his back hurt all the time. So I tried to explain to him that he had no stability in his spine because he was sitting all the time, and he was creating this muscle imbalance. And he did not believe me initially. So I had to it was kind of funny, but I think a little frustrating for him. I actually had him do a plank, which is a pretty simple exercise, right? Had him just hold that position. And I said, if you can beat me at this position, and I'm by no means a strong guy, but I have good core stability, kind of have to practice what I preach. So I said, if you can beat me at this, great. If not, then maybe I might know a thing or two about what's going on with your back. So anyways, we got him into the plank position, and he couldn't hold it for more than 15 seconds. He just did not have the stability to maintain it. And then he's like, oh, you're right. But it wasn't until I showed him how weak he was in that particular position. And we did a few other things to kind of provoke his core muscles, so that he saw that although he was training all of these big, strong muscles, the ones that were supporting him were not doing their jobs. So, and he did really well. He actually only needed a few sessions. I gave him some homework. He would go work on it really hard, come back in a couple weeks. Those guys that are that motivated and focused on their body, it doesn't take much for them to build those muscles. So he just needed a little guidance, and he got better very quickly.
Yes.
Yeah.
Interestingly, no matter how active you are, or what's your age or your gender, you all will be at risk to have a spinal dysfunction or an atrophy of a muscle. And I have been a Pilates and yoga teacher from 2010. So it's been a long time, over 12 years. And I'm telling all my listeners that 2 months ago, I was actually diagnosed with osteoarthritis, one slip disc, which is what you just say about the ladies, exactly that spondylosis.
Ankylosing spondylosis, spondylolisthesis, yeah.
Exactly, that's exactly what I have in my sacrum, which gives me a lot of instability on my pelvic floor. So I am really practicing my breath when I do my Pilates. I'm actually having a little bit more, perhaps, patience, because sometimes we are very in the go-go. And I noticed that the more patience we have with our core, the better to really feel the activation of the muscles. So absolutely. Yeah, I understand. So no matter if you're active, you may be active like this athlete story that you say, and you may not have a proper activation of the core. So yes. Like you say, sometimes no matter if you still have the issue on the bone, you still have to stabilize with the muscles. So it's important to know the strength of the core is one of the most important, valuable pieces. That's why they call it powerhouse, right? Yes. Before we finish our call, which we're getting very close to our 30 minutes, I wanted to talk a little bit short about your back pain workshop. Tell me a little bit about what's your goal with this workshop, and what would be the main intention from the workshop? Sure.
So first I'll say the day of it is September 21st. It's an online workshop, so anybody from anywhere in the world, I guess, can log in. It's in the evening, 7:30 p.m., and that would be Eastern time. The goal of the workshop is just to help educate people about spinal health. Often people come in and they think, oh, I saw these exercises online and I tried to do them and they made me worse. And there's actually two types of what we call biases with back pain, and educating people about what their bias is, and then using that as kind of a framework for what exercises they should be doing, what treatment they should be doing, and how that can guide their lifestyle is a big part. So I'm really hoping to give people some simple tools that they can take away and use to help their back pain, or to relieve their back pain.
Oh, super, super. So can you please repeat us? So it's September 21st?
Correct, yeah. And I think it's 7:30 p.m. And I can send you a QR code if you want.
Sure,
so
yes,
I don't know if you
send
do
it to us.
Sure.
I will add it on in the show notes. And this is going to be an hour?
Yes, yeah. It'll be, yeah.
Perfect. Yeah, if I have the free time, for sure I will join it and hear more about this really interesting webinar. And are you going to be sharing the time with other physiotherapists from your group, or will be only you?
Sometimes some of my colleagues jump in and help with answering questions or giving different perspectives. As of right now, I think I'm the only one scheduled on it, but I'm trying to pull some people in, so we'll see.
Okay, super. Well, this month, my friends, we are in September 2022. and it's the World Wellness Weekend between the 16th and the 18th of this month. There's going to be 140 countries all over the world, more than 4,000 cities participating, Toronto participating, perhaps Guelph will be participating. And basically, I wanted to invite you to send me a word. If you write brain body, I will send you an invitation to 7-day commitment for the brain body commitment. I don't like to call challenge because for me, challenge always comes with this resistance to it. I call commitment because it's just you're willing to learn. So it's actually 7 days practicing exercises that will actually activate your vestibular system, which we will be talking with Dave in the future. And basically, we will be practicing about how do we train our eyes, our jaw, how can we release our neck. This part of our body is so crucial for a whole performance, because when you have a loose neck, now your brain can be connected to the spine properly, and you're not really creating tension in your veins, in your arteries, in your main fuel of connection. So it's like a gateway. Imagine your neck like a gateway, and we just want to loosen it up so your brain can be at the full potential and performance when you're working. I'm learning all this from Posture Pro. This school is actually in Montreal. I'm constantly looking for new education, new knowledge. And I learned so much with this school, Posture Pro. And I'm actually going beyond the joints. I really love to learn about breathing. How can we actually improve our body when we know how to breathe with more patience, slower, more through the nose, nasal breathing, right? And also, how can we train our eyes? We forget about training our eyes. We have over 6 muscles in our eyes, and we never train them really with attention. So these practices will be 7-day practices. So if you actually want to be part of the 7-day commitment, I'm making a list of at least 100 people together to get into this commitment. So send me a word, brain, body, and then I will send you the program. So thank you. And for Dave, for sure, I would love to have a call with you next week and continue with these conversations, especially about the vestibular system. I want people to know what is the vestibular system and why this is so important for our spine and our health in general. So Dave, any social media that you want to share with people out there so they can get to talk to you, especially if they're in Guelph and they need a physiotherapist now?
Yeah, if they want to email me directly, it's dave@eramosaphysiotherapy.com, or you can check out @Eramosa Physio on Instagram. And we have a website. If you type in Eramosa Physio into Google, we'll pop up. I'm in the Guelph clinic. We've got 10 clinics throughout kind of southwestern Ontario. So yeah, lots of ways to reach us. And then if you do go on the Instagram, you can actually find in our posts there also the link to join our course, if you do want to pop on for that.
Yes, I will add all the links that he just mentioned on the show notes, so you have the access. Eramosa, for those people that are listening to the podcast, Eramosa is ERAMOSA, Eramosa Physiotherapy. And I will be sharing everything on the show notes. I'm excited always to bring all these specialists in the spine because I get to learn so much. Today, I learned that being fit is not only to look sexy, it's also for our spine. Yes, I always remind people, very important for our joints. Stay fit, stay in your proper body weight so your joints don't suffer. So thank you so much, my friends. Remember, if you have questions and comments, I would love to hear you. We would love to hear you because we're here on service for you. Thank you so much, Dave, and I'm looking forward for our next call. Thank you.
You're welcome.
We invite you to subscribe to this channel and share with your community. Please leave comments below, and if you like the episode, click the like button. Have a beautiful day.